Hello, I'm Dr. Ruth Roberts, your pet's ally. I hope all is well for all of you. And I've got a couple of pretty funny pictures to show you, which we'll tie back to. But we're, as many of you know, we're traveling across the country and staying in different people's places and whatnot. But at any rate, we stayed in a little camper that wasn't quite as finished out as the bus we stayed in March, and in fact we're staying in that very same bus now. But we got to experience cooking the CrockPet Diet in a very different way, which was on a wood stove. So this photo here, you can see the, here it is, the little wood stove, here's the two pots, and then here's kind of more of the finished product. So there's the veggies in one pot, and then the pork tenderloin is what we were cooking on this batch. So we just got it all hooked together and got them cooked, and then completed the deal, so to speak, by throwing the two together and then just using the immersion blender to kind of mix things up, and we were good to go. So that's a first for me. We're generally using all sorts of different methods, but I just wanted to show you all that so that you could take a look at it. It was pretty fun. So to that point, Dana, who's a new member, and welcome Dana, you were asking about cooking methods. So there you go. It can be whatever works the best for you. And you got lots and lots of comments about what other folks are doing. So we, when we were cooking for 10 pets, we had hotel pans that we were using in the ovens, and that worked really well. But as you can see, you can really do it kind of anywhere with anything. So, whatever works the best for you is what to go with. Since we've been traveling, most often we're using a big stock pot, whatever's available in the house. As you saw, we had to resort to our two smaller pots to get things done in this, this time around. So Instapot, they're supposed to be super quick. I know a lot of y'all love them, as that's just really been kind of the best deal for many people, because you can get it done so quickly. Pressure cookers, roaster pans in the oven, tabletop roaster pan, all of those things are great. So whatever it takes to get things done, that's what you need to do. And then Dana, and I think a different Dana, was asking about, and maybe it's the same one, but at any rate, the question was about recipes calling for 8, 9, and 10 tablespoons of oil, depending on the protein that's used. And using the no bean recipe called for 9 tablespoons of olive oil and ended up with a pot of grease she couldn't feed to her dogs. So here's what I would say. They are correct. So if you take something out, you got to put something back in, calorie-wise. And so we took out beans, and so what I put back in is fat. And yes, that's probably more fat than you are accustomed to seeing. And if your dogs are fat adapted, that is perfectly okay to do. It will not create pancreatitis in them. So you do have to be careful with coconut oil. Long term, that has created some issues, particularly in schnauzers and other breeds that are more predisposed to making, to not dealing with oils well. So things like high triglycerides, things of that nature. The recipes are correct as far as calorically being matched out and things of that nature. Now, if you don't want to pitch the whole batch, what I would do is simply add in some more quinoa, which is the grain that's called for in that batch. And if you're really trying not to feed beans, then that's, we're going to have to make some shifts. So to give you some frame of reference, I believe that a tablespoon of oil, olive oil, is about 120 calories. And then I think that a cup of cooked beans was something like 240 calories. So if we took out the beans, we've taken out basically um, 2 cups of beans. Then you got to add in fat to make up the difference there, or you can add in a different carbohydrate source. So that's another option for you. So I'm afraid you've probably pitched this at this point, but that's what I would do, is either add in more of a starch, whether that's potatoes or grain or quinoa, rice, what have you, and then that will make up the difference if you cannot feed that much fat. So hope that is helpful, Dana. If you need some clarification on that, please do not hesitate to reach out, and be happy to get you some more answers on that. So hope that's been helpful. Good to see everybody, and it just worked out. I had enough service and timing was right to do this live, so we'll see how that goes. So let's see, Denise was sharing some information about Hemangiosarcoma and Yunnan Baiyao capsules, and using Coriolis mushrooms and a couple of other things. And I know, Denise, you're really tracking on using fenbendazole to help shrink cancer as well. So, so the wonderful thing is, the post you're sharing is that this person has 8.5 months, their pet has 8.5 months post-splenectomy, and she's doing great. And so far, no evidence of spread. So that's wonderful. But Yunnan Baiyao, for those of you that do not know, is an herbal formula that is used specifically to control bleeding. And the thing that is really interesting about it is that it will stop acute bleeds, meaning all of a sudden that hemangiosarcoma has broken, or nosebleed, or even for dogs that I anticipated having difficulty spaying, we would use this prior to surgery, and it was much less difficult for both the dog and for me. So those are typically older female dogs that are a little bit obese. It was just that was just not fun. Sometimes they tended to bleed quite a bit. So that's wonderful. And then also I used to use Yunnan Hangyao on long term to help reduce new blood vessel growth into tumors. So glad to see that this is spreading a little bit more, but these are all go-to solutions. And let's see, and Penny was asking about her pup Lola is getting subcutaneous fluids, and she's wondering if she should be drinking water. And probably not, Penny, because it's she's getting plenty from both the food and from the subcutaneous fluids she's getting. And I am delighted to hear the adaptive collar is working. So, and it's working so well, you have to take it off when you get home, so she's not too mellowed out. So that is a fantastic way to go. She was getting up super early at 4. Oh, fantastic. This is all wonderful stuff. So let's see. Callie is asking about her pup's compromised immune system from taking Apoquel. Off that for 2 years. He's got PLE and really severe allergies. And she needs more help with getting him to eat real food. So, Kelly, I'm not quite sure what's going on as far as, do you have problems getting him to eat CrockPet Diet, or he's just kind of iffy about eating in general, or what's what? So, if the Apoquel and the other drugs tend to really trash the gut. And so what I would suggest doing is looking at the gut support protocol if you haven't already in the free members area. But really, this is where I would use things like the Glacier Peak Holistics test to to tell you, give you kind of a guideline as to what may be creating issues, and then you can take that out of the diet, and then really go for a what's called a rotation and elimination diet. So that's kind of what I would suggest. That gets a little bit detailed, and so if you need some help with that, please let me know. I'm happy to get on a complimentary phone call to give you some direction, and also for you to decide if working with me via consultation would be helpful. So that's what I would start with, Kelly, and then try to avoid everything that he's been eating as far as proteins and things like that, so that his immune system sees something else. And you guys have got some great questions, so I will get back to those in a few minutes too. Debbie was asking about IVDD. So her little pup, Daisy, had blown a disc, had surgery, and still has had other issues. So have any of you experienced problems with intervertebral disc disease in the past? The interesting thing is that it is, or currently for that matter, the interesting thing is that it is similar to hip dysplasia for big dogs, but it's just a chondrodystrophy, meaning the cartilage didn't grow correctly, but it's in the intervertebral disc space, and there is some association with the doxies and bassets tend to be real problematic because of the length of the back and the impact and things of that nature. So, if we're talking about preventing it, then Debbie, you frankly did everything you were supposed to do as far as feeding an anti-inflammatory diet and things of that nature. What's really breaking my heart in conventional medicine is that so many of the emergency vets, if you are unwilling to spend $5,000, actually it ends up to be $10,000 at the end of the day, for an MRI and back surgery, they tell you to euthanize your pet. And it is just ridiculous, absolutely ridiculous. So that's just killing me, because people are putting their pets to sleep needlessly, when in many cases this can be managed medically, meaning using some anti-inflammatories, whether that's steroids or non-steroidal drugs, and or skeletal muscle relaxers, and acupuncture or laser therapy, and a whole host of other things. So that's kind of the short trip, but that's where things that I talk about frequently, like high doses of omega-3 fatty acids, probiotics, et cetera, are really, really helpful. So that's kind of the short and the long of it. So I hope that's helpful, Debbie. Unfortunately, her little pup Daisy has really had a hell of a time after surgery, and she is elderly. So I think there is something to that. We forget that as we age, our energy stores go down, and our recovery time gets longer and longer. Lee is asking about milk thistle, and she's been giving patients the milk thistle twice daily for some time. And Lee, for patients, that was appropriate for a bit. For most people, we just use it once a week, 1 week out of each month, to kind of do a liver cleanse. So long term, I feel like milk thistle ends up pushing the liver too much. And so we might switch it up with other things like glutathione or dandelion root or something of that nature. So I think rotating them is a good idea. N-acetylcysteine is another really good one as well. So hope that's helpful. For patients, I mean, she's made so much progress, I think you could probably take her off of the milk thistle long term and just go with a daily, once a month sort of clean out, if you will. And then Lolly was asking about the Instapot or pressure cooker, and I think, the idea behind Chinese medicine, some of the semantics make sense, but some of them, if it's going to make it easier for you to keep up with cooking by using a pressure cooker or an Instapot, go for it. Now, the other question Lolly asked was, what are good shoes to keep pups' teeth clean? And and there are some dogs that will chew obsessively and wear their teeth down. So somebody mentioned Veggie Dents. I don't recommend those because they really, as somebody else pointed out, they really are full of crap. Cornstarch and all sorts of soy and other garbage. And they do like them, but I think there are better options out there, and I think raw bones are a great one. So for instance, with Mona, she would chew until she literally created neck pain for herself. So for her, we have to, just limit the amount of time that she gets with a fresh bone. So we'll generally get the beef bones, which are the long tibia. So if you get them whole, they're something like this long and, at least that big around, if not bigger. So for Mona, we get them cut into little slices that are about, 2 inches thick, something like that. That's appropriate. That's easy for her to get her mouth around. It's all good. The other thing we've had to do too is her gut's gotten more sensitive to big doses of fat or bone marrow. Actually, she had way too many bones when we were having to go back to the East Coast. The pet sitter got a little overzealous with the bone administration, so to speak. So go for it. There's tons and tons of different options out there. If you're using bones, use raw bones. If your teeth is chewing to the point where they're getting worn down, give them the bones, access to bones, or whatever it is you decide to use for, say, 15 minutes a couple of times a day. And I think that will help reduce the tartar considerably, but not create any excess wear. For Mona too, when we've been out of the house, she likes to go chew on her bone because it helps her really to relieve her anxiety. And I see over in the comments somebody's asking about antlers. I think that's great. Mona wouldn't eat those, so you just got to see what your dog will and won't put up with. So I hope that makes sense. And then May was asking about freezers and storage containers and all of that good stuff. And what I would say there, May, is figure out how much volume-wise you want to produce and store so that you don't have to do this on a regular basis. When we had so many pets, we were using the plastic storage containers that were fairly good size. They were about 12 by 12. I think they held about 4 quarts apiece. So we needed an upright standard size freezer. It used to be you could get them really cheap at used appliance places, so that's worthwhile to check out. One of the deals with freezers is that if you keep them full, they don't pull that much power once everything is frozen. So I hope that is helpful. And then storage containers, do what makes sense. And yes, BPAs are a concern, but I hate to say it, we're all eating and drinking more plastic than we ever thought about. It is what it is. So if that works for you, and you can get BPA-free ones, although I'm not totally convinced there isn't some other thing in there because it's plastic, go for it. Do what makes sense and what is affordable as well. So I hope that's helpful, May. I loved your everybody's decorating tips on the freezer. That was pretty funny. Sita, welcome. And yes, use what you got. You just need to make sure you get to 2,000 milligrams of calcium per 3 pounds of protein. Tums are calcium carbonate. Just avoid the ones with colors and flavoring. I mean, I've used Rolaids when we've been on the road, like when we were in Roatan. That was kind of all we could get for a calcium source. So, that's all good. Just avoid this. Look at the ingredients, because what's in Tums to kind of hold the calcium together and make it pretty colors and flavors is stuff you don't want. The Rolaids, I've had an easier time finding just plain mint flavored ones with the least amount of garbage in it. So I hope that's helpful. And as far as calcium source, calcium citrate is more readily absorbable. Calcium carbonate works well. I did get away from bone meal because we kept seeing so many issues with heavy metal toxicity and recalls of those products. So I would definitely avoid those. And then Donna's asking about carrots, and her cats are not digesting them. And so what I'd say, Donna, is yes, you can use winter squash, any kind of yellow-fleshed squash. So acorn squashes, butternut squash, that sort of stuff. In place of the carrots, you may need to cook a little bit longer or use an immersion blender to kind of get it down to more of a pate consistency. So I hope that's helpful. And Donna, rock on for getting your cats to eat real food. That is a feat in and of itself. Let's see, let me go back here to some of these comments. So Anne's asking, aren't grains such as rice inflammatory? And you're trying to avoid that. So, Anne, I think what is super inflammatory are highly processed parts of those grains. So, and for individuals, anything can be. So what I would say is that if you notice that your dogs and cats are better off of, and cats actually should not be eating grains, they really just are not built to do that. But if your dogs are better off of rice and other grains, great, leave them out of the diet. And that's where you're going to need a keto type diet, possibly. And so that's where you add in oil. So again, you have to look at your individual pet, and in the case of having multiple pets, your individual pets, and find out what's best for them. So by themselves, are those grains inflammatory? No, they're not. But what happens is the way most dog food and pet food is made is that they are processed down to this powder that actually gets absorbed almost immediately into the bloodstream as sugar. So here's a weird thing. So do you guys understand the concept of glycemic index in food? So the idea is that when you eat something, you get a certain amount of sugar from it. And so, for instance, the glycemic index of sugar is pretty high, but you know what's actually higher than sugar is whole wheat bread. And I'm not talking about the whole grain stuff, I'm talking about like the rainbow version of whole wheat bread. So that's my point, is that these very, very finely ground grains, that's the problem, and that's what tends to be pro-inflammatory. So I hope that helps, Anne. And I think, and I'm sorry, the comments on eCam is a little bit difficult to follow. I think Lisa was asking, actually, Lisa, good to see you. I think Lisa was asking about her pup having chronic urinary tract infections. And there's several things that, and again, this just depends on the individual dog. And I know that your pup had horrible bladder stones secondary to bladder infection. So D-mannose is always a good place to start. There's several suggestions. Methioform, again, that's used to help acidify the urine. And so it just, there's a lot of different things. The 8 Treasures, I've used that actually for several different, sometimes even for stone dissolution. So these are all options. And again, it depends on your individual sort of situation with your pet. So let's see, there's a few more in here. And let me see if I can pop these comments up. You may hear the audio on the video for just a second here, so bear with me. There we go. All right, now we got it killed. All right, so let me get over to these comments so I can see who's asking what. Um, let's see. Good to see you too, Lee. Got that? Okay, so April's asking about an appetite stimulant for her pup. And frankly, April, if you're having to deal with that, I'm not sure if Thor is the one that you've had issues with, Sharpei fever or not, but if that's, I think I would get him to a vet sooner than later. Using an appetite stimulant in the face of not knowing what's going on is not a great thing. It's, so that's the thing. I mean, most of the appetite stimulants are medication, so you really would need to, he is the one. So you really would need to get a prescription from a vet. I mean, I've used B12 injections, but again, you still need a script for that. And the other ones, that's kind of it. So it sounds like he's probably still pretty uncomfortable. So I know that's not too helpful, April, but I definitely would get him checked out. And then somebody was asking about the adapto collar. Jane. Jane, you're a glutton for punishment. Good for you, though, for rescuing a 14-and-a-half-year-old golden. And so, yes, you can use that. But the other thing is, with that pup's age, I would be a little concerned about discomfort and pain and or cognitive dysfunction. But, try it, because if it is anxiety and she's just getting adapted to your house, and hopefully Eva's getting on well with her, give it a try. I mean, it's certainly not going to hurt. And the nice thing about the adapto collars is they are like little bubbles of happy wherever she goes. So I think that may be a good idea. Let me know if that doesn't work out. There's a few other tricks, but that way it'll help you sort of sort out what's what. I think I got everything. Did I miss anything? Any questions you all had? I think that's got it covered. So that's what I have for you this week. Be back in hopefully in good internet for most of the next several months. So we should be able to get this done a little bit more easily. So that's what I have for you this week. If you have any other questions, let me know. Yeah, definitely, April. Try that for Raven. That may be helpful. I think we had talked about that too. Please let me know. Keep the questions coming. Keep the support coming. You guys are doing a fantastic job of taking care of each other, and I just love seeing that. I'm glad to have started something where people are helping each other and taking care of each other. That's part of life. And Anne, my pleasure. You all have a great week. Until next week, remember, your pet's best health starts in the bowl. Many thanks.